Hi everyone. After undergoing the recent COVID pandemic, it becomes extremely relevant and necessary to refresh our knowledge about the devastating Spanish flu. Named so not because it started in Spain, but because other countries were involved in World War I. So they weren't covering the news of this flu, whereas Spain, being neutral with respect to the war, extensively broadcasted the pandemic news. Hence, it appeared that Spain was the hub of the pandemic. So, in 1918, this new influenza virus emerged. Overcrowding and global troop movement of World War I helped the viral spread. The vulnerability of healthy young adults and the lack of vaccines and treatments created a real major public health concern. Did you know a flu pandemic is a global outbreak of disease among people caused by a new flu virus? This would probably be very different from the current influenza viruses routinely infecting humans. Therefore, most people around the world would not have immunity to the same, resulting in a lot of people getting sick and dying. This virus had genes of avian origin. There have occurred four influenza pandemics in the past 100 years broadly in 1918, 1957, 1968 and 2009. All of these were caused by new viruses with genes that came from birds. Wild birds are hosts to some bird flu viruses that normally don't make people sick. However, influenza viruses keep changing or mutating all the time and can exchange genes. Rarely, this phenomena makes it possible for an animal flu to change so that now it can make people sick. The 1918 pandemic, taking place in three distinct waves, was the most serious of all. It lasted from February 1918 to April 1920. About 500 million or one-third of the entire world's population became infected with the virus and at least 50 million died. Common targets were small kids less than 5 years old or 20 to 40 years old and 65 and older. The saddest part was that even the young and healthy were not spared by this. The flu ended only after a huge number of people had either died or suffered and acquired active immunity. Flu pandemic killed more people in a single year than HIV has killed in 40 years and bubonic plague has killed in a century. People sometimes expired in 24 hours or lesser also, mostly due to organ failure and pneumonia. At that time, there was no medical care available, the only feasible thing being non-pharmaceutical interventions such as isolation, quarantine, good personal hygiene, use of disinfectants, restricting public gatherings, so on and so forth. In 1918, scientists had identified many bacterial pathogens, but viruses had not been discovered yet, so they could not identify the cause of influenza. The factors increasing the risk worldwide include rapid population growth, increased international travel, and the proximity of humans to animals that may carry different flu viruses. Now, 104 years later, the world has made major advances and progress in the science of flu prevention and control. Since its founding in 1946, CDC has worked to address the continuing threat of flu, including preparing for future flu pandemics if at all they happen, although God forbid. We now are equipped with tests for timely diagnosis of influenza, vaccines to prevent it, and drugs to treat influenza and its complications. Medical advances since the 1918 flu include effective vaccines to help prevent infection, drugs to treat illnesses, antibiotics to treat secondary bacterial infections, ventilators and intensive care units to treat serious patients, and modern gloves, gowns, and masks to protect frontline caregivers. We also possess a global influenza surveillance system to monitor flu activity, to do collaboratory research, and superb ways to quickly calculate and globally share the prediction of the pandemic and the precautionary information. Brahmjeet Dahiya and Archana Ayagari, really, from the core of their heart, thank you for watching this video. We shall be back soon together with another enlightening video for our lovely audience. Stay working hard and remain blessed. Bye till next time.